Hi, my name is Alana Ackham, and I am a ambulatory clinical pharmacist at the Froedtert and Medical College of Wisconsin. I work on our primary care pharmacy team, specifically in our GLP-1 weight management program. And I am here today to give a lecture topic on macronutrients, a guide to healthy eating for weight loss. And we will cover various macronutrients and what that entails specifically for carbohydrates, proteins, fats, fiber, and hydration. So, first, we will start with covering what are macronutrients. So, macronutrients are defined as the main nutrients that we find in food that provide energy to our bodies and that maintain and support our physiological functions. They are essential for growth, metabolism, and health. And typically, we measure these in grams, and that can be used to keep track of our consumption of food. So, you might see a lot of folks download apps on their phone that help with calorie tracking or macronutrient tracking, whether that's carbohydrates, proteins, fats, and that is all going to be measured in grams. Now, it is important to point out no healthy diet should exclude or seriously restrict any macronutrient. They are all equally as important, but the real question remains how much of each should you eat and what are the best sources to do so? So, the three main essential macronutrients are going to be carbohydrates, proteins, and fats. So, carbohydrates' main function is that they are the source of energy and that they help to break down glucose to aid in digestion and fullness. The components of carbohydrates are sugars, starches, and fibers, and they typically contain about 4 kilocalories per gram. Protein's main function is to build and repair our muscles, tissues, and organs. They do also aid in enzyme and hormone regulation and creation and support immune function. The components of proteins are amino acids, and they also contain about 4 kilocalories per gram. Our fats function as long term energy and help with cell growth. They protect organs, they help with nutrient absorption, and they do break down into fatty acids and glycerol to help provide fat soluble vitamins like vitamins A, D, E, and K. The components of fats include saturated and unsaturated and trans fats. And our unsaturated fats can further be broken down into mono or polyunsaturated fats, which we'll talk about a little bit later. And fats contain about 9 kilocalories per gram. So, what are the recommended amounts of our essential macronutrients? So, the 2025 Dietary Guidelines for Americans provide some general recommendations, which I have included here. For carbohydrates, typically the recommended amount is about 45 to 65% of our daily calories. For proteins, the recommended amount is 10 to 35% of our daily calories. And for fats, typically around 20 to 35% of our daily calories. Of note, less than 10% of that should be from saturated fats. Now, like I said, these are general recommendations. These goals can be different for everyone. So, someone may want to count their macros for weight control, while other people might want to use them to help build their muscles or even sustain their blood sugar levels. So, sometimes how much of the recommended amount they need can vary depending on the purpose you're doing it for. Your percentages can also change based on your age, sex, medical conditions, lifestyle, how active you are. So it is important to consult a professional such as your provider or registered dietitian to see what percentage of macronutrients is right for you specifically. First, we will cover carbohydrates as our first major group of macronutrients. Carbohydrates are considered the body's primary fuel or energy source, and it does give energy to the muscles and central nervous system, especially during movement and exercise. So, how many grams of carbohydrates you per meal that's recommended can vary on average based on requirements for women and men. So for women, typically they require a 30 to 45 gram count of carbs per meal, whereas men typically require a little bit more, around 45 to 60 grams of carbs per meal. For snacks, for both men and women, 15 to 30 grams of carbs are generally recommended to be considered for a healthy diet for weight loss. Some examples of healthy carbohydrates that you can include in your meals include fruits, so kind of things like apples, berries, for example, because those are going to be high in fiber. Dairy, like milk or yogurt, starchy vegetables like potatoes, corn, peas, squash, beans, or lentils, and then grains and starches, that'd be things like your breads, rice, crackers, or cereals. Now, we'll talk about in just a second what we would consider to be healthy versus unhealthy types of grains, so stay tuned for that. But these are just some examples of various carbohydrates and what you can use to help balance your plate. Carbohydrates that we recommend to limit or avoid are things you probably would traditionally think of as unhealthy. So it's going to be a lot of our added sugars or really sweet beverages or desserts. So any sweets or desserts like your cookies, your pies, your pastries, your brownies, etc., those are all going to be something you want to avoid or limit if you are trying to lose weight. Jams, jellies, and honey, especially if they're overly processed, can be really high in carbs and sugars. Added sugars to anything really that you can buy at the grocery store is something to watch out for. Now, we will be covering how to read a food label and how to look out for added sugars in another lecture series. But I always tell folks when you are getting something from the store, make sure you look at the carbohydrates section on the food label. And if there are any added sugars, that is something you want to try to limit or avoid as well. And the thing that can really add up in calories and carbs is sweetened beverages. So things like regular soda, juice, sugary, fruity drinks that can really add up. So I tell folks really just choose diet or sugar-free beverage options if possible. Those are going to be a little bit better for you. So, like I mentioned before, some examples of healthy carbs and what we'd consider unhealthy carbs or grains are listed here. So, the general recommendation is we want to choose whole grains over refined grains. So, whole grains are going to be a really good source of fiber. They really help with digestion, they help to keep you full and stabilize your blood sugar. So, you're going to want to go for these in your diet rather than refined. So some examples of whole grains would be things like quinoa, whole wheat bread or whole grain pasta, brown or wild rice, or rolled or steel cut oats. And then things that I'd consider to be less healthy for you in terms of grains would be many cereals, honestly, that especially have enriched wheat flour can not be very high in sugar. Any white breads or white pasta and flour, any sort of white rice or instant oatmeal. You want to try to limit or avoid those as you can and stick with some of those good whole grain options because those are going to be key for weight loss. Next macronutrient that we will cover is proteins. Proteins are going to be essential to a lot of different processes in our body, like we mentioned before, such as providing structure to our skin tissues. So that can include things like our organs, hair, skin, nails, bones, tendons, blood plasma. And they really help to regulate a lot of different systems in the body that are metabolic, hormonal, and our enzyme systems. The general recommendation for protein intake per meal is about 20 to 30 grams or a 60 to 90 grams per day average. And the recommended daily allowance, if you're calculating based off your weight, is zero point 0.8 grams of protein per kilogram per day. I will say again, individual needs are going to vary though by age, activity level, medical history, and health goals. So, like I mentioned before, if you're looking to just lose weight versus looking to, build muscle, maybe you do bodybuilding or some sort of strength training, you might want to consume more protein than someone who's just looking to maintain the muscle they already have. Some examples of protein I have listed here. So there are a couple categories, starting with our lean meats on the left here. Lean meats can include things like chicken breast, turkey, lean cuts of beef, and pork. Those are all great options. We typically want to avoid things that are more fattier, like ribs, fatty steaks, or sausages, because those are going to be higher in calories. And more counterintuitive for weight loss efforts. Fish is also an excellent source of protein and healthy omega-3 fatty acids that can help with cholesterol reduction. Salmon, tuna, and cod are great choices. If fresh fish is out of your budget, frozen or canned options that are more specifically packed in water and not oil are going to be just as nutritious. If you maybe don't eat meat or you're looking for more plant-based options, things like lentils, beans, chickpeas, tofu, tempeh, nuts, seeds, those are all excellent. They're also high in fiber and they do help stabilize your blood sugar levels while also keeping you full for a longer period of time. Eggs are another affordable, very versatile, and high quality source of protein. So they are going to contain all the 9 essential amino acids that are needed, making them a very complete protein, and they're low in calories. So they're pretty good for a weight loss diet. You can cook them in so many ways. You can boil, scramble them, put them in an omelet or other baked dishes. And if you're concerned about your cholesterol, you can also choose other egg options like egg whites or a mix of whole eggs and egg whites as well. Lastly, dairy products, specifically low-fat or fat-free options such as Greek yogurt or cottage cheese are going to be very rich in protein and calcium, so good, healthy for your bones as well. You'll notice that was also a category in carbohydrates, so that can overlap with some protein and carbohydrate content, but you want to make sure you look for options that have no added sugar if you're looking for ways to cut down on your calories. I always recommend to folks try incorporating a variety of these protein sources in your meals. You'll stay very satisfied, and this will really help support your muscle health while working towards your weight loss goals. How do you get more protein in your diet? So, a couple recommendations are listed here. So, first and foremost, we recommend to try to replace more of those processed carbs with higher quality proteins. So, some of those examples that I listed on the previous slide. So, no added sugars, kind of look out for that, replace that with some protein. Like I mentioned, choose a variety of different types of proteins. Don't feel like you have to eat eggs for every meal or meat for every meal. Choose a variety of plant and animal proteins. It gives you some variety in your diet so you don't get sick of it, keeps things interesting, and keeps you from getting burnt out with your dietary changes. If you're looking for healthy snacks, try to replace things that are really processed and fatty, like chips, with things that are more protein based, like nuts or seeds. Similar concept, think of replacing your sweets with or baked desserts with things like Greek yogurt. They come in different flavors, strawberry or fruit options. So if you're looking for more of that sweet flavor, but not packing in a punch with all of that carbs and calories, try a Greek yogurt. I always recommend too to pair protein with your carbs. So, especially for snacks, if you typically have a fruit as a snack, which is a carbohydrate, try pairing that with some protein to keep you full longer. So, that could be a cottage cheese or a string cheese or some nuts, seeds, something like that. And then lean meats at meals are preferred if you're looking to get in high amount of protein throughout the day. So, your chicken, your fish, things like that, try to incorporate that in. And then another thing not listed here is for those meats, do not choose fried options with breaded coatings. That's really going to add to your calorie count, your carb count. We're looking at grilled or baked options if you are looking to minimize that and maximize your weight loss. The next macronutrient we will cover is fats. Fats are going to be essential for our energy reserves. They insulate and protect our organs, and especially for absorption and transportation of our fat-soluble vitamins, which I did mention previously in the presentation. So there are various types of fats. So those include saturated fats, unsaturated fats, which further breaks down into mono or polyunsaturated fats, and then trans fats. So I like this graphic for looking at the different types of fats. So it has red X's next to the fats. We're trying to minimize what we take in, and then a green check next to the fats we want to take in. So the green check there with unsaturated fats, those are going to be more of our healthy fats we would like to maximize. So like I mentioned before, there are two categories that further break down in unsaturated fats, which is poly and monounsaturated. So some examples of polyunsaturated fats would be things like your margarine, mayo, salad dressing, various types of oils listed there like corn, soybean, sunflower oil, seeds, um, walnuts, for example, those sort of things. Monounsaturated fats, again, various types of oils like our olive oil, canola, peanut oil, sesame oil, avocados, which also can have some protein in them, and most nuts or nut butters or olives would fall in this category as well. Now, the fats on the left and those red X's that we're trying to limit more of, especially our trans fats. So those are going to be things like our hydrogenated vegetable oils, a lot of fast foods or sweets like cakes, pastries, and chocolates are going to have that in it, and deep fried food. So these are things we really want to avoid or minimize severely if we are trying to lose weight. And then saturated fats here in the middle, again, trying to minimize these as well because this is the fat that's going to be associated with high cholesterol and heart disease. So these would be things like your bacon, your butter, cream, lard or shortening, sour cream, coconut palm or kernel oil. Those are going to be less ideal if you're looking for improving your cardiovascular health or weight loss. So a general recommendation, like we kind of mentioned on the last slide, it is best to choose unsaturated fats, which if I know it's hard to keep track of, well, what's saturated, unsaturated, what have you. Usually these are going to be liquid rather than solid at room temperature. However, I will say nuts and seeds and avocados are going to be the exception to that. But generally, you think of things like your oils and non-dairy spreads. Things like olive oil, avocados, nuts like your almonds, walnuts, pistachios, various seeds like chia or flax, um, your fatty fish, even like salmon, are great sources of healthy fats. And these fats are heart healthy and they do help with nutrient absorption. So, one serving of healthy fats is typically about a teaspoon or 5 grams, which is about 45 calories with each serving. We try our best to, again, avoid those saturated fats and trans fats for weight loss and cardiovascular health. Just some general recommendations for cooking, for oils especially. Canola or olive oil over butter are going to be preferred, much less of that saturated fat. And then you want to watch out for salad dressings. Preferably, you want to try tossing those with oil and vinegar instead, just because a lot of our salad dressings can have added sugars in them too, or added unhealthy fats. While healthy fats are important, they are calorie dense. So I do mention to folks it is important to consume them in moderation, especially to regulate your cholesterol. So for those recommended servings we mentioned earlier in the presentation, stick to those if you are looking for healthy weight loss. Next, we'll further dive into fiber, which isn't necessarily a macronutrient category of its own. This would generally be considered a carbohydrate, but it is important to talk about fiber and how we incorporate this specifically in our diet for weight loss. So, fiber is defined as a type of carbohydrate that is found in plant foods. That'd be things like your fruits, veggies, whole grains, nuts, seeds, and beans. We did talk about quite a few of these on the previous slides, so you can refer to that for examples of what these would be. And we'll talk about that a little bit further in the following slides as well. The main function of fiber is to aid in digestion and regular bowel movements. So it is helpful to incorporate this into your daily diet, especially if you are taking one of the GLP-1 weight loss medications, as constipation can be a side effect with those medications. So I'll break down some examples of high, medium, and low fiber foods in the next few slides, depending on what you're looking to get out of it. Generally, we recommend a high fiber diet for folks who are on GLP-1 medications for weight loss because, like I mentioned on the last slide, they do have a side effect of constipation. So some examples of high fiber would be any food in these categories that contains 4 or more grams of fiber per serving. And again, you would see that located on the food label on the side of whatever food you're purchasing from the store. So for fruits, that could be a half cup of raspberries or blackberries. That could be a medium pear or apple, a couple pieces of dried prunes or guava. For veggies, that could look like a medium baked potato, cup of squash, half cup of peas, pumpkin, or sweet potatoes. Grains, that could be a half cup of bran cereal. It could be a cup of quinoa or cooked oatmeal, 3 cups popcorn, a cup of spaghetti, and then for proteins, that could be a various amount of beans. About a half cup of pinto, kidney, soy, baked garbanzo, or black but white beans would all be considered very high fiber foods you could utilize. So, medium fiber foods are listed here. They're typically around 1 to 3 grams of fiber per serving. So for our fruits, that could be anything like a banana or a small orange, melons, strawberries, cherries, a fourth cup of raisins, half cup of blueberries or applesauce. For veggies, it could be more of some of our green vegetables. So broccoli, Brussels sprouts, carrots, about a half cup of those. Or cauliflower, green beans, could also be carrots or corn or potatoes. One medium tomato or sweet potato could fall in this category as well. Grains, there's a lot of different options that are more medium fiber. So things like brown rice, a corn tortilla, or one bagel. We did mention oatmeal, so like a half cup of oatmeal or multigrain cereal, a cup of macaroni noodles or half cup of whole wheat spaghetti, or a slice of whole wheat bread. And then for more protein-based foods that have fiber in them, that could be like your nuts and seeds. So a half cup of almonds, sunflower seeds, walnuts, flax seeds, or veggie or soy patties too do have some fiber in it as well. And lastly, things that contain low fiber amounts. So usually this would be less than a gram of fiber per serving. So maybe you're not struggling as much with constipation if you're in this category. And maybe it's the opposite. Maybe you're having looser stool issues with the medication or in general. These things would include like a half cup of fruit juice. For veggies, more things like cucumber slices, lettuce, or celery. For grains, again, a flour tortilla or a half cup of white rice. Meats or proteins be things like 1 egg or 3 ounces of meat or poultry or fish. And then dairy would be more 1 cup of milk or yogurt. Next, we'll cover hydration and the importance of drinking water throughout the day and just beverage content for calories because that does play a big role with weight loss as well. Just some general rules on beverage intake. So we always want you to focus on plain water intake. And a goal for adequate hydration would be at least 64 ounces daily or more. If you are drinking other beverages, we do recommend to try to consume things that are 0 calorie, unsweetened, or diet, such as like diet soda, tea, or black coffee. Avoiding adding like creamer or sugar into your tea or coffee just because those calories can really add up, especially for alcohol or sweetened beverages like regular soda, juice, or sweet tea. Those can add actually hundreds of extra calories and are very rich in added sugars, and that can really counteract some of the weight loss efforts you're doing. So, a great first step for weight loss is just cutting out all those sugary beverages and trying to replace that as best you can with water or 0 calorie options. Now that we've covered each various type of macronutrient and hydration and fiber, how do we put this all together and balance our plates with each meal to maximize our weight loss efforts? So you may ask yourself, how do I balance my plate? So our recommendation is something called the plate method, which you can find variations of this method in different resources, but especially like the American Diabetes Association or the CDC. But generally, what is recommended with the plate method is to start with a 9-inch dinner plate, fill it half with non-starchy veggies like a salad, broccoli, green beans, something like that. Fill a fourth of it with lean protein, like anything we recommended before: chicken, fish, eggs, beans, tofu, and then fill the remaining quarter with a carbohydrate. So that could be your whole grain bread, pasta, rice, or some fruit like an apple, for example. Now, a good question is, well, how do I estimate portion sizes and what is considered like a normal amount or a normal portion of the healthy food that I want to eat? So I like this graphic that's provided. that helps you to use visually your hands to demonstrate kind of how much maybe might be a recommended amount of each type of macro. So, for example, if you're looking to measure out like 3 ounces of meat, fish, or poultry, for example, which I'd consider a normal serving, would be about the palm of your hand, not including your fingers. That's graphic number 1 there. 1 ounce of cheese or meat is about the size of your thumb from the tip to the base. So that would be graphic number 2 there. 1 cup or 1 medium fruit would be about the size of your fist for an appropriate serving. So that's graphic number 3. 1 to 2 ounces of nuts or pretzels would be like about the size of your cupped hand. So that'd be graphic number 4. 1 tablespoon would be more about your thumb tip, so the tip to the first joint of whatever you're trying to measure. That's graphic number 5. And then a teaspoon is even smaller, would be about the size of a fingertip, so the tip of your finger to the first joint, which is graphic number 6. If you're eating out, that can be a little harder to ask. So usually I try to tell folks that if you find the portion sizes are pretty huge when you're going out to eat, ask for a to-go box. Ask for half your meal to be wrapped up so you can enjoy it later. At home, you can measure out your snacks using these methods, but we do recommend just don't eat straight from the bag or the box because it's really hard to, limit your portions when you're doing that. After a while, you find maybe I've ate 10 pieces or more or half of the box at some point. So it's really helpful to measure that out first to prevent yourself from eating too much. And then at dinner time, if it's helpful to reduce the temptation to go back for seconds, it's nice to keep serving bowls maybe out of reach or limiting yourself to a specific size bowl that's small and measuring that specifically out beforehand so you don't feel the need to go back for a second portion. So just a couple tips, but again, think this graphic's super helpful for measuring out portions. Lastly, we will go over some dietary considerations for macronutrients for people who are taking GLP-1 injectable medications for weight loss. Some general considerations for people who take GLP-1 medications are listed below here. So our first recommendation is to continue to eat 3 meals a day. Do not skip meals, even if your appetite is going to be reduced, even if they are smaller meals. Still try to consume 3 meals per day. This is to keep up your nutrition. I know it can be easy for folks to skip meals because these drugs do reduce food noise. They do make you feel faster and longer throughout the day. But it is essential and key for weight loss to make sure and muscle mass maintenance to make sure you are maintaining a healthy 3 meals a day. We recommend that these 3 meals do have a focus on protein. So that could be any of the protein that we discussed. So our lean meats, eggs, beef, tofu, etc. And we recommend to eat that first because protein is going to be the most important nutrient to prevent lean body mass loss, which can occur with these medications long term. We do recommend to fill half your plate with non-starchy veggies, like we talked about with the plate method. So again, this could be things like broccoli, green beans, cauliflower, salads, carrots, and then also adding a high fiber carb. So some of those more healthy whole grains we mentioned, like whole wheat bread, pasta, beans, or small portions of potato. Some other considerations include eating until you feel satisfied and eating slowly. So, kind of what I tell patients is this sounds very obvious, but stop eating once you get full or start to slow down with your meal. Because if you eat past the point of fullness, that can really trigger side effects like nausea or stomach upset after a meal. And usually that indicates your portion size is maybe a little too big at that meal that you are eating. So make sure you attune yourself to that feeling of being full and stop eating when that happens. If you feel like you are filling up fast, like I said on a previous slide, consider using a smaller plate or having a plate that you consider your measuring plate, but still making sure that is balanced with your non-starchy veggies, protein, and high fiber carbs. Another thing that's important is water and hydration. Like I mentioned before, sipping on water between meals throughout the day can curb hunger. So if you maybe are having some breakthrough hunger while on a GLP-1, hydrating can take away some of those hunger pains. And I also highly recommend it for maintaining healthy bowel movements. So water and hydration are going to be key to preventing constipation as well, on top of fiber intake. If you are not able to eat 3 smaller balanced meals and maybe you're eating 1 or even 2 small meals a day or not at all, that is where I tell patients, please, please, please talk to your provider. Your medication might need to be adjusted. At that point, we're looking to balance appetite control, but not complete appetite suppression. We still want you to get your nutrients in and have a healthy diet for weight loss and not achieve that by starvation. So that's a typical reminder for folks that, hey, maybe my dose does need to be decreased if you get to that point. If you are on a GLP-1 weight loss medication and you are having some side effects, so maybe some abdominal pain or nausea, there are a couple of tips that you can do to help either the day before, of, or after your injection. One specific tip I give to folks can be sometimes if you're struggling with nausea, especially on the day of the injection, moving your injection time to the evening. So if that nausea comes on, you're asleep, and then you're not feeling that during your day-to-day routine, that can be helpful. From a more dietary standpoint, you can consider cutting back on your portion by about a third. Waiting 30 minutes, and then if you're still hungry, you can finish the additional 1/3. This is especially if you find you're getting a lot of nausea after meals, might be indicating your portion sizes are too big, so that's a nice strategy that can help some folks. And the last tip that I give is just avoiding really greasy, high fat foods, especially the day of, before, and after your injection. But just in general, so that'd be things like really greasy burgers, pizza, anything that's deep fried. Those can trigger folks to feel pretty nauseous. Sometimes it can trigger loose stool or things like acid reflux. So minimize that or really avoid it completely if you're looking to avoid GI side effects. Things that won't upset your stomach would be more like bland foods. So I'm thinking like baked chicken, eggs, fish, cottage cheese, things like banana, applesauce, rice, various green vegetables. If they're not too fibrous, that might give you some stomach upset. But these are all good options if you're struggling with some of that stomach upset. So pick more bland, avoid the fried foods, and cut back your portions if you're finding it's more of a portion issue after meals. That is everything I had for you today. Thank you so much for listening to the presentation. If you have any questions, please feel free to reach out. My email is listed here. Happy to take any questions. And hopefully you found something helpful that you learned today that you can incorporate into some dietary changes to start your weight loss journey. Thank you so much and have a great rest of your day.